Have you ever heard the expression, "you are what you eat"? While you can't take this literally, this simple saying contains a lot of truth. The foods you choose to eat determine which nutrients your body will receive and in what quantities. Nutrients are substances that allow your body to make energy, build and maintain tissues, and regulate bodily processes. If you eat a healthy diet filled with a variety of high-nutrient foods, you are more likely to enjoy good health than if you eat a poor diet that is lacking in nutrients. This lesson will provide an overview of nutrition, which is the process of taking in nutrients from foods, by looking at the 6 classes of nutrients: carbohydrates, lipids, proteins, water, vitamins, and minerals. 3 of these 6 classes of nutrients are referred to as macronutrients because they are required in large quantities. The prefix macro means large, so this is a fairly easy term to remember. The macronutrients are carbohydrates, lipids, and proteins. They're somewhat unique because they are the only nutrients that provide your body with energy, which is measured in calories. Of the 3 macronutrients, your body looks to carbohydrates for quick energy, because carbs are readily available when there's an immediate need for energy. All carbohydrates come from food, but different foods contain different types of carbohydrates. For example, when you eat a cookie, you're consuming mostly sugars, or simple carbs. Whereas your spaghetti dinner contains a lot of starches, which are complex carbs made up of many sugars. Eat some fruits and veggies, and you will take in fiber, a type of carbohydrate that cannot be digested. This means you can't get energy from fiber, yet fiber is great for moving foods through your digestive tract, so you want plenty of it in your diet. Lipids, which are commonly called fats, have more calories per gram than the other macronutrients, so you can think of them as energy-dense nutrients that are a perfect source of sustainable energy when you need some endurance. Like carbs, there are different types of fats. Saturated fats, like butter, are solid at room temperature. Unsaturated fats, like vegetable oils, are liquid at room temperature. As for proteins, they do contain calories, but because proteins are so important for growth, development, and repair, your body uses them as a last resort source of energy. You get proteins in a variety of animal and plant foods, with meats and beans being good sources. Your body then breaks these protein-containing foods down into amino acids, which are the basic building blocks of proteins. The amino acids are then reassembled into thousands of different types of body proteins. Water is another class of nutrient. Some nutritionists categorize water as a macronutrient because it's needed in large quantities, but it's typically placed in its own category because, unlike the other nutrients, it's a single substance. Water makes up about 60% of your body weight. It's easily lost through urine, sweat, and evaporation, so you need to frequently fill up by drinking liquids and eating foods that contain water, like fruits and vegetables. The functions of water are important because it lubricates your joints, transports substances around your body, and regulates your body temperature, so you never want to be low on water. The opposite of macronutrients are micronutrients, and as you might have guessed, they are required in small quantities. Our last 2 classes of nutrients, vitamins and minerals, are micronutrients. Micronutrients do not contain calories, which means they do not directly provide your body with energy. However, one of the functions of vitamins is energy metabolism, which means they help your body convert calorie-containing nutrients into energy. Other functions include maintaining your vision, protecting your cells from damage, and helping with blood clotting. Vitamins are either fat-soluble, which means they can be stored in fatty tissues, or water-soluble, which means they dissolve in water and are easily flushed from the body. As with vitamins, we see that there are many different functions of minerals within your body. These include everything from transporting oxygen in your blood, to helping with proper thyroid function, to strengthening your bones. Minerals are either trace minerals, meaning they are minerals needed in relatively small or trace amounts, or major minerals, which are minerals needed in relatively large or major amounts. Both vitamins and minerals can be found naturally in all of the food groups. You can also get them from supplements or from packaged foods like breakfast cereals or dairy products that have been fortified, meaning they contain added vitamins and minerals. Let's review. Nutrition is the process of taking in nutrients from foods. Nutrients are substances that allow your body to make energy, build and maintain tissues, and regulate bodily processes. In this lesson, we looked at the 6 classes of nutrients: carbohydrates, lipids, proteins, water, vitamins, and minerals. We learned that carbohydrates, lipids, and proteins are macronutrients, meaning they are required in large quantities. Carbohydrates are quick energy. The different types of carbohydrates are sugars, starches, and fiber. Lipids provide sustainable energy. The different types of fats are saturated fats and unsaturated fats. Proteins are a last resort source of energy. We learned that the basic building blocks of proteins are called amino acids. Water makes up about 60% of your body weight. The functions of water are that it lubricates your joints, transports substances around your body, and regulates your body temperature. We also learned that vitamins and minerals are micronutrients, meaning they are required in small quantities. Vitamins are either fat-soluble or water-soluble. The functions of vitamins include energy metabolism, maintaining your vision, protecting your cells from damage, and helping with blood clotting. Minerals are either trace minerals or major minerals. The functions of minerals include transporting oxygen in your blood, helping with proper thyroid function, and strengthening your bones. Living in a world where a variety of foods are readily available is a blessing. Food is around us constantly, and we are bombarded by ads on TV, flashy food labels in stores, and convenient food options at every turn. Yet many of these foods are highly processed and low in nutrients, which can make it tough and somewhat confusing when trying to choose the healthiest eating plan. It's good to keep in mind that healthy eating is not about depriving yourself of all your favorite foods or about trying to be super skinny. Instead, following a healthy eating plan is about bringing benefits to your life that include feeling good, stabilizing your mood, providing energy, maintaining your ideal weight, and helping you avoid diseases such as heart disease, diabetes, and cancer. With these benefits in mind, let's take a look at how to develop a healthy eating plan. The U.S. government provides some help with choosing a healthy diet through the Dietary Guidelines for Americans, which are diet and lifestyle recommendations designed to reduce the risk of chronic disease and promote health. These recommendations come from the U.S. Department of Agriculture, which you may know by its initials USDA, with some help from Health and Human Services. These two departments work together and update their recommendations every 5 years. The guidelines recommend that you get your daily nutrients from 5 food groups. The first food group to consider is vegetables, and the important thing to recall when selecting these foods is to vary your veggies. A diet that contains a variety of dark green and red and orange choices mixed in with beans and starchy vegetables provides a powerful punch of nutrients. Of course, you cannot sustain yourself on vegetables alone, so the dietary guidelines also recommend the fruits food group. In fact, fruits are so nutritious that there should be a focus on fruits that includes selecting whole fruits like apples and oranges more often than fruit juice. Another important food group is grains. Grains come in many forms, and some are refined to a point where many of their nutrients have been removed. Because of this, the government recommends that you make half your grains whole. Whole grains contain the entire seed of the plant, which includes the bran, the germ, and the endosperm. When a grain is refined, the bran and germ are removed, along with many of the nutrients. The guidelines also recommend adding the dairy food group to your eating plan, so remember to drink your dairy, but make it low-fat or no-fat to meet the government recommendations. The 5 food groups are rounded out with the protein food group. Protein can be found in animal products, such as meats and eggs, but the important point to recall is that you should go lean with protein to avoid saturated fats and cholesterol that can have negative health implications. This means you want to include a variety of protein choices by adding lean meats, poultry, seafood, nuts and seeds, as well as beans to your healthy eating plan. You might recall that beans were also part of the vegetable group, which makes them somewhat unique. Beans contain nutrients found in vegetables, such as fiber, folic acid, and potassium, but they also provide minerals found in meats, such as iron and zinc. Because of their unique blend of nutrients, they fit in both categories. Choosing foods in these 5 food groups that are low in saturated and trans fats, cholesterol, salt, and added sugar provide your body with the nutrients needed for a healthy eating plan. For example, foods found in the protein group give your diet a zip by providing zinc, iron, and protein, along with B vitamins. Vegetables, fruits, and whole grains increase your intake of fiber, vitamins, folic acid, and potassium. Adding low-fat dairy foods also increases potassium intake, while at the same time providing calcium and vitamin D. Over the years, the USDA has published food guides to help the public meet their daily nutrition needs. You may remember the food guide pyramid that came out in 1992, or the My Pyramid food guidance system that came out in 2005. In 2011, the USDA came out with My Plate, which is another revised nutritional guide set forth by the USDA. While the food guides and the images used to illustrate them do change over the years to reflect updates in the dietary guidelines for Americans, they all serve the same purpose, which is to provide a simple guide for healthy eating. For example, My Plate is a visual guide designed to look like your dinner plate. This makes it easy to balance your meals with the right portions of the different food groups. Therefore, My Plate can be used to plan a diet based on the dietary guidelines for Americans that we have been discussing. By looking at the plate icon, you can see that it is broken up into the 5 food groups. When you look even closer, you see that it reveals the proper portions of foods. So you see that half of your plate should be from the vegetable and fruit groups, about 1/4 from the grains, and another 1/4 from the protein group. Dairy is shown in the corner as if it is a glass of low-fat milk waiting to wash down your meal. Let's review. Following a healthy eating plan brings many benefits to your life, including feeling good, stabilizing your mood, providing energy, maintaining your ideal weight, and helping you avoid diseases. The USDA and Health and Human Services teamed up to develop the Dietary Guidelines for Americans, which are diet and lifestyle recommendations designed to reduce the risk of chronic disease and promote health. The guidelines recommend that you get your daily nutrients from 5 food groups, including vegetables, fruits, grains, dairy, and protein. Specifically, you want to remember to vary your veggies, focus on fruits, and make half your grains whole. These food groups provide fiber, vitamins, folic acid, and potassium. When you drink your dairy, you increase your intake of potassium, calcium, and vitamin D. And when you go lean with protein, you avoid saturated fats and cholesterol while adding a little zip with zinc, iron, protein, and B vitamins. To keep all these recommendations straight, you can use My Plate, which is a nutritional guide set forth by the USDA. My Plate can be used to plan a diet based on the dietary guidelines for Americans. It includes the 5 food groups along with their recommended portions.
All was calm in the rainforest. A beautiful butterfly lands on a flower in search of nectar, but unbeknownst to the butterfly, a well-concealed predator is only inches away. In a fraction of a second, the chameleon strikes out with its tongue, snatching the butterfly from the flower and drawing it into its mouth. The chameleon begins to chew. Wait, chameleons don't chew, but little boys like Timmy who pretend to be chameleons do. As Timmy chewed the butterfly and physically broke it down into smaller pieces, his salivary glands went to work, releasing saliva containing amylase, which is a digestive enzyme found in saliva that breaks large polysaccharides into smaller polysaccharides. Amylase is capable of breaking every other bond between sugars in a polysaccharide. Between chewing, which physically breaks the butterfly into smaller pieces and creates greater surface area for enzymes to contact, and amylase, which begins breaking complex carbohydrates down into smaller polysaccharides, the digestion of the butterfly has already begun. The tongue then forms the chewed up and saliva-soaked food into a ball and directs it to the back of the mouth, where it enters the pharynx, which you may remember is the junction of the mouth and nasal airways that leads down the throat. However, unlike the air that passes through the larynx on its way to the trachea and lungs, the food must enter the esophagus, which is the tube that serves as a passage for food from the pharynx to the stomach. When Timmy swallows, his larynx, or voice box, moves up, and at the same time a cartilaginous flap called the epiglottis flips downward to cover the larynx, preventing the food from continuing down the airway. Instead, the food is directed into the esophagus, where muscle contractions push the food down the entire length of the esophagus and into the stomach. The stomach is a fairly large organ with an elastic wall that is capable of stretching to make room for over half a gallon of food and fluid in the average person. The stomach wall is lined by a layer of epithelial cells and has lots of deep pits that lead to the gastric glands. The epithelial cells inside these glands secrete the different components of gastric juice, which are designed to liquefy food and continue the process of chemically breaking it down into smaller components that can be absorbed by the body. One major component of gastric juice is hydrochloric acid, which you may remember is a very strong acid and can be represented by the abbreviation HCl. Because of its acidic properties, hydrochloric acid kills most bacteria found in food. It also does a very good job of dissolving most of the types of tissues that we eat into a liquid form that is much more accessible to digestive enzymes. Unfortunately, hydrochloric acid inactivates amylase, which leaves the polysaccharides only partially digested. Speaking of digestive enzymes, another major component of gastric juice is pepsin, which is a digestive enzyme that breaks proteins down into smaller peptides. You can remember the function of pepsin if you remember that pepsin breaks proteins into peptides. But this function of pepsin raises a fundamental question. How does a cell make an enzyme that breaks down proteins without the enzyme damaging the proteins in the cell itself? The answer is that the cell makes an inactive form of pepsin named pepsinogen, which is several amino acids longer than active pepsin. The extra amino acids block the active site of pepsin, causing it to be inactive inside the cell where it can damage other proteins. However, the hydrochloric acid in the gastric juice removes these amino acids, converting the inactive pepsinogen into active pepsin, once it is out of the cell and in the gastric juice inside the stomach. To keep them from digesting components of the secretory cells, most digestive enzymes are produced in an inactive form known as a zymogen, which is an inactive precursor of an enzyme which requires a change to be activated. In this case, pepsinogen is a zymogen, which is activated by hydrochloric acid and turned into active pepsin. So why doesn't the pepsin and hydrochloric acid digest the epithelial cells that line the stomach? It turns out that most of the epithelial cells of the stomach secrete large amounts of mucus, which forms a barrier to protect the cells against the acid and pepsin. In addition, the stomach isn't always filled with gastric juice. Between meals, the stomach is empty and pretty much inactive. However, when a person sees, smells, or otherwise anticipates eating food, the brain sends a signal to the stomach to start preparing for a meal. As a result of this signal, the epithelial cells secrete a small amount of hydrochloric acid into the stomach, and the smooth muscles of the stomach are also activated and start churning the stomach at a slow rate. This churning of the stomach without food in it is what causes your stomach to growl when it's getting close to mealtime. When food actually enters the stomach, it activates the full response of the stomach. The epithelial cells secrete lots of gastric juice, and the smooth muscle of the stomach is fully activated, causing the stomach to churn and thoroughly mix the food and gastric juice until it is liquefied. The stomach then releases its liquefied contents into the small intestine, a little at a time through the pyloric sphincter, which is the muscular valve at the bottom of the stomach that controls the flow of partially digested food into the small intestine. It takes about 2 to 6 hours for the stomach to completely empty its contents into the small intestine in this manner. During that time, the churning motion and release of gastric juice by the stomach is ramped down until the stomach is empty and essentially powered down. That is, until it receives the next signal from the brain to start powering up again. So let's review. As soon as you put a piece of food in your mouth, your body starts the digestive process. Salivary glands release saliva that contains amylase, which is a digestive enzyme found in saliva that breaks large polysaccharides into smaller polysaccharides. And chewing begins the physical process of breaking large chunks of food into smaller pieces. The food is swallowed and directed by the epiglottis down the esophagus, which is the tube that serves as a passage for food from the pharynx to the stomach. The stomach wall is lined by a layer of epithelial cells and has lots of deep pits that lead to the gastric glands. The epithelial cells of the stomach secrete 3 major products: mucus that protects the epithelial lining of the stomach, hydrochloric acid, and pepsinogen. Pepsinogen is a zymogen, which is an inactive precursor of an enzyme which requires a change to be activated. But hydrochloric acid converts it to the active enzyme pepsin, which is a digestive enzyme that breaks proteins down into smaller peptides. Together, pepsin and hydrochloric acid are the major components of gastric juice, which essentially liquefies food and continues to break it down into smaller components. Between meals, the stomach is empty and pretty much inactive. However, when a person sees, smells, or otherwise anticipates eating food, the brain sends a signal to the stomach to start preparing for a meal. As a result of this signal, the epithelial cells secrete a small amount of hydrochloric acid into the stomach. Smooth muscle is also activated and starts churning the stomach at a low rate. When food actually enters the stomach, the epithelial cells secrete lots of gastric juice, and the smooth muscle of the stomach thoroughly mixes the food in gastric juice until it is liquefied. The stomach then releases its liquefied contents into the small intestine a little at a time through the pyloric sphincter, which is the muscular valve at the bottom of the stomach that controls the flow of partially digested food into the small intestine. The stomach empties and powers down until it receives the next signal to prepare for a meal. When we last left Timmy, he was playing in his backyard, pretending to be his favorite animal, a chameleon. Oh yeah, and he also ate a butterfly. We followed the path that the ingested butterfly took down Timmy's upper gastrointestinal tract, from his mouth to his pharynx, down his esophagus, and through his stomach. Now let's continue on our journey through Timmy's digestive system as we follow the path that the food takes through the lower gastrointestinal tract. We know that liquefied food and gastric juice is released by the pyloric sphincter a little at a time from the stomach into the duodenum, which is the first section of small intestine where digesting food enters from the stomach. A lot of people think that this food is now digested into products that can be absorbed into the bloodstream, but that's not the case at all, because full digestion of the food still requires a lot more work. As soon as the liquefied food and gastric juice enters the duodenum, the acid and partially digested food stimulates the pancreas to secrete bicarbonate, water, and many different digestive enzymes, which flow into the duodenum to mix with the gastric juice. You may remember that bicarbonate is a base, and that bases neutralize acids. So when the bicarbonate secreted by the pancreas mixes with the gastric juice, it neutralizes the acid. Meanwhile, digestive enzymes are secreted from the pancreas as zymogens, which you may remember are inactive precursors of enzymes which require a change to be activated. These zymogens are activated by other enzymes in the duodenum and then start breaking carbohydrates into smaller sugars and proteins into peptides and amino acids. Once the carbohydrate chains have been broken down into monosaccharides, they can be transported across the luminal membrane and into the epithelial cells of the small intestine. Likewise, proteins and peptides can't be absorbed by the small intestine, but once they are broken down into their component amino acids, these are easily transported into the epithelial cells. However, fats are a little more complicated. You see, fats, which are also called lipids, are hydrophobic. They repel water and clump together with other lipids because when they clump together, they have less interaction with the water. But this means that they are insoluble. They won't go into solution, and they aren't available for soluble digestive enzymes to break them down. Fortunately, our liver produces bile salts, which coat the lipids and keep them separated into tiny droplets that don't clump together. These tiny coated droplets give the digestive enzymes enough surface area to gain access to the lipids and break them down. One such digestive enzyme is lipase, which is an enzyme that breaks lipids down into monoglycerides and fatty acids. These monoglycerides and fatty acids can then be absorbed by the small intestine. Although the liver produces bile, it is stored in the gallbladder, which then releases it into the duodenum when digestion is taking place. The small intestine can be broken down into three parts. We've already talked about the first part, the duodenum, which is the very first section of small intestine where the pancreas, liver, and gallbladder add their digestive enzymes, bile, water, and bicarbonate to the digesting food. Following the duodenum are the jejunum and then the ileum. These sections are specialized for the absorption of monosaccharides, amino acids, monoglycerides, fatty acids, and water. The epithelium is structured into large folds that increase surface area and which increases absorption. And sticking out from the folds are finger-like projections called villi that further increase the surface area and absorption. Even the epithelial cells of the villi themselves are covered with tiny finger-like projections called microvilli, which again further increase surface area and absorption. Digesting food is moved through the small intestine by a process called peristalsis, which is the slow rhythmic contraction of the smooth muscle in the intestinal wall. Peristalsis moves digested food through the small intestine, where most of the nutrients and water are absorbed before it enters the large intestine. The large intestine, or colon, functions mainly to reabsorb most of the water that wasn't reabsorbed by the small intestine. Again, peristalsis moves what is left of the food through the large intestine and finally into the rectum, which is the last part of the large intestine where feces are stored before they are eliminated through the anus. So let's review. The duodenum is the first section of small intestine where digesting food enters the stomach. Contrary to popular belief, most digestion occurs in the small intestine and not the stomach. Not only does the duodenum receive digesting food from the stomach, but it also receives water, bicarbonate, and digestive enzymes from the pancreas, and bile from the gallbladder and liver. As the food is moved through the small intestine by peristalsis, carbohydrates are broken down into monosaccharides, proteins are broken down into amino acids, and lipids are broken down into fatty acids and monoglycerides. The monosaccharides, amino acids, fatty acids, and monoglycerides are then transported into the epithelial cells of the jejunum and ileum, which are the absorptive portions of the small intestine. The absorptive surface of the small intestine is arranged into large folds that increase surface area and which increases absorption. Sticking out from the folds are finger-like projections called villi that further increase the surface area and absorption. Following the small intestine is the large intestine, or colon, which functions primarily to reabsorb most of the water that wasn't reabsorbed by the small intestine. Again, peristalsis moves what is left of the food through the large intestine and finally into the rectum, which is the last part of the large intestine where feces are stored before they are eliminated through the anus.
Calories tend to get a bad rap because of their association with the obesity epidemic. Yet calories are vital because there are a number of necessary metabolic processes, such as breathing and maintaining a constant body temperature, that require calories for energy. In fact, if we had to narrow down the purpose of calories, we would say that calories provide energy, and we can define a calorie as a unit of measure used to express energy. Calories come from nutrients, which are the components of foods that we need for survival and growth. However, there are only 3 nutrients that provide calories. Do you know what they are? I'll give you a hint. One of them is found in abundance in this piece of bread. Another is found in this piece of chicken, and the other makes up this stick of butter. I wonder if you guessed correctly by saying the 3 nutrients that contain calories are carbohydrates, proteins, and fats. Together, these 3 nutrients are called macronutrients. There are also 2 micronutrients, which are vitamins and minerals. And water is considered a nutrient as well. However, taking a vitamin pill and washing it down with a glass of water would not provide the body with any calories. It's interesting to note that the 3 energy-yielding nutrients, fat, proteins, and carbohydrates, do not all supply the same amount of calories per unit of weight. We see that a gram of fat provides 9 calories, while a gram of protein provides 4 calories, which is the same for carbs, as a gram of carbohydrate provides 4 calories. It's fairly easy to recall that fats provide the most calories per gram if you think of fat as the nutrient that makes you fat, although this is not really how it works. The federal government has developed recommendations for energy intake to help you stay healthy and maintain a healthy weight. The Estimated Energy Requirement, or EER, provides us an estimate of the total calorie count needed to maintain energy balance. So you can see that this term's name does a pretty good job of explaining what it is. It is truly an estimate of the amount of energy you require to get through your day. It's based on calculations that account for factors unique to you, including your age, gender, height, weight, and physical activity level. As these factors change, so does your EER. For example, if you start a running program, then you will require more energy from calories. These are only estimates, and each individual will be different. Because of this, the federal government and other reputable sources have made online tools and EER calculators available to help you estimate your daily energy needs. But to give you an idea, estimates provided by the Dietary Guidelines for Americans place the ranges from 1,600 to 2,400 calories per day for adult women and 2,000 to 3,000 calories per day for adult men, depending on age and physical activity level. The EER tells you how many calories you need, but you can get even more specific by using the Acceptable Macronutrient Distribution Ranges, or AMDRs. AMDRs tell you the recommended ranges for the percentage of calories from carbohydrates, fats, and proteins. Here again, the term's name does a fairly good job of explaining what it is. AMDRs are literally the acceptable range of macronutrients, which we know include carbohydrates, proteins, and fats, that you need to maintain good health. The goal of these recommendations is to provide guidelines for proper nutrient intake so an individual can reduce their risk of chronic disease while at the same time take in adequate amounts of essential nutrients. These recommendations are expressed as percentages of your total energy intake. You should aim for 45 to 65% of your calories from carbohydrates, 20 to 35% from fats, and 10 to 35% of your total calorie intake should come from proteins. So we see from these recommendations that your diet should focus on carbohydrates such as grains, fruits, and vegetables. Providing ranges gives you some wiggle room that allows a little freedom when it comes to choosing which foods to include in your healthy diet. Let's review. A calorie is a unit of measure used to express energy. Calories come from nutrients, which are the components of food that we need for survival and growth. More specifically, calories come from the 3 macronutrients: carbohydrates, proteins, and fats. However, they do not all supply the same amount of calories per unit of weight. We see that a gram of fat provides 9 calories, while a gram of protein provides 4 calories, which is the same for carbs, as a gram of carbohydrate provides 4 calories. There are also 2 micronutrients, which are vitamins and minerals, but they do not provide the body with calories. The estimated energy requirement, or EER, provides us with an estimate of the total calorie count needed to maintain energy balance. It is based on calculations that account for factors unique to you, including your age, gender, height, weight, and physical activity level. The acceptable macronutrient distribution ranges, or AMDRs, are the recommended ranges for the percentage of calories from carbohydrates, fats, and proteins. You should aim for 45 to 65% of your calories from carbohydrates, 20 to 35% from fats, and 10 to 35% of your total calorie intake should come from proteins.
In many cases, maintaining a healthy diet with optimal nutrition is much easier said than done. There are many reasons why nutritional disturbances occur. Having an illness, such as the flu, can cause vomiting and easily create a nutritional deficit. Heartburn can cause pain when certain foods are eaten and cause a person to avoid these foods or eating altogether in some cases. Some people simply do not have access to the food they need and are malnourished. Any of these situations, and many others, can create a nutritional disturbance. So what is a nutritional disturbance exactly? A nutritional disturbance is any situation that causes a nutritional imbalance or deficit. A nutritional deficit is an inadequate supply of essential nutrients, such as vitamins and minerals, in the diet, resulting in malnutrition or disease. This can happen because a person isn't eating properly or because their body isn't able to absorb nutrients normally. In this lesson, you'll learn about different common nutritional disturbances and how they can affect a person's nutritional status. Vomiting is the discharge of stomach contents via the mouth. In many cases, vomiting is caused by gastroenteritis, or inflammation of the gastrointestinal tract, often due to the stomach flu. But there are other causes of vomiting, such as pregnancy or poisoning. Vomiting is usually self-limiting and not serious. However, in more serious cases, it can lead to severe dehydration and require treatment with intravenous fluids and anti-nausea medication. Heartburn, or acid reflux, occurs when contents of the stomach reflux, or leak, back into the esophagus. The contents of the stomach are acidic and cause a burning sensation and pain when it refluxes into the esophagus. Not only does this cause pain for the person, but over time this can cause erosion and even cancer to the esophagus. This is because the cells in the stomach are designed to handle the high acidity level of stomach contents, but the cells of the esophagus are not. Heartburn is often treated with proton pump inhibitors, which are medications used to lower the amount of stomach acid that is produced. Long-term use of proton pump inhibitors is known to cause nutritional deficits of vitamin B12, calcium, iron, magnesium, folic acid, and zinc. The deficits of these nutrients can be detrimental on the body and cause conditions such as osteoporosis, which causes weak bones, or anemia, which is low levels of iron. Obesity is a condition of being highly overweight. This is a worldwide issue and is projected to surpass tobacco use as the most modifiable risk factor in public health and disease. Besides contributing to many diseases such as heart disease, diabetes, and cancer, obesity is also a nutritional disturbance. Despite typically having a high dietary caloric intake, obese people tend to have very high rate of nutritional deficits. This is often due to a diet of high-calorie, nutrient-poor foods. Obese individuals are often deficient in the following nutrients: vitamins C and D, chromium, and thiamine. In addition to these deficiencies, people with type 2 diabetes are also often deficient in biotin. Deficiencies in these nutrients are known to cause insulin resistance, increase the risk of complications from diabetes, or cause other serious health conditions or diseases. Anorexia nervosa is a psychiatric disorder characterized by abnormal eating behavior, severe self-induced weight loss, and psychiatric comorbidities. People with anorexia severely limit their dietary intake, which makes it a nutritional disturbance and leads to nutritional deficits. Anorexia is a life-threatening condition that can result in death from starvation, heart failure, electrolyte imbalance, or suicide. Malnutrition is a condition that results from eating a diet in which nutrients are either deficient or oversupplied and cause health problems. It is a category of diseases that includes undernutrition and overnutrition. Undernutrition results in stunted growth, wasting, and deficiencies of essential vitamins and minerals. Wasting is the weakening and loss of muscle, fat, and other tissue of the body. Overnutrition can result in people being overweight or obese. Two specific forms of malnutrition are kwashiorkor and marasmus. Kwashiorkor is caused by inadequate protein intake, resulting in low amino acids. This causes swelling of extremities and belly, wasting, liver enlargement, and depigmentation of skin and hair. Marasmus is caused by inadequate intake of protein and energy in the form of calories. It causes severe weight loss, little or no swelling, minimal fat reserves, and muscle wasting. It is typically seen in famine, significant food restriction, and severe cases of anorexia. A nutritional disturbance is any situation that causes a nutritional imbalance or deficit. A nutritional deficit is an inadequate supply of essential nutrients, such as vitamins and minerals in the diet, resulting in malnutrition or disease. This can happen because a person isn't eating properly or because their body isn't able to absorb nutrients normally. Vomiting is the discharge of stomach contents via the mouth. It can lead to severe dehydration and require treatment with intravenous fluids and anti-nausea medication. Heartburn or acid reflux occurs when the contents of the stomach reflux or leak back into the esophagus. Heartburn is often treated with proton pump inhibitors, which are medications used to lower the amount of stomach acid that is produced. Long-term use of proton pump inhibitors is known to cause nutritional deficits of vitamin B12, calcium, iron, magnesium, folic acid, and zinc. Obesity is a condition of being highly overweight. This is a worldwide issue and is projected to surpass tobacco use as the most modifiable risk factor in public health and disease. Anorexia nervosa is a psychiatric disorder characterized by abnormal eating behavior, severe self-induced weight loss, and psychiatric comorbidities. People with anorexia severely limit their dietary intake, which makes it a nutritional disturbance and leads to nutritional deficits. Malnutrition is a condition that results from eating a diet in which nutrients are either deficient or oversupplied and cause health problems. It is a category of diseases that includes undernutrition and overnutrition. Undernutrition results in stunted growth, wasting, and deficiencies of essential vitamins and minerals. Overnutrition can result in people being overweight or obese.
You know that you are a unique person. There are so many things that set you apart from a huge chunk of people: age, gender, culture, athletic ability, and so much more. When combined, those differences create a truly unique person, of which there is no other but you in this world. I think that's pretty nifty. These differences are also important because they influence appropriate dietary choices. Just as an example you can certainly agree with, pregnant women have very different needs than your average male office worker. This, and so much more, will be touched on as we explore some of the many factors that influence dietary choices. They say that men are from Mars and women are from Venus. In some respects, men and women think differently, act differently, and have varying needs even in the same situation. Dietary habits are not immune from this observation. Let's think of some examples together using averages we know to be true. Women are smaller than men. This means women need fewer calories than men, meaning they need to eat less food. If an average woman was to consume the same amount of calories as the average man, she'd be more likely to gain weight, all else equal, of course. But there's something very important here. There's a danger in consuming less food and thus fewer calories willy-nilly. The right kind of food contains nutrients that go beyond just calories. There are vitamins and minerals within our food. That is why a woman should focus more on consuming nutrient-dense food like complex carbohydrates in order to ensure important vitamins and minerals are gained while still eating fewer calories than a man. Think of it this way. A donut has a ton of calories but is not very nutritious. A whole grain cereal may have the same amount or even fewer calories than the donut but is rich in vitamins, minerals, and fiber. Importantly, two nutrients known as calcium and iron are of special concern for women. Calcium is a mineral that helps to build strong bones, and iron is a mineral that helps to form red blood cells. Calcium is necessary because women are more likely to develop osteoporosis, a condition that leads to fragile bones. Iron is important for menstruating women because it helps to avoid iron deficiency anemia. Anemia is a low red blood cell count. But I don't want to leave out the guys here. Although men generally consume more food and thus are less likely to suffer from nutritional deficiencies, there are still plenty of problems associated with this type of diet. Eating too much red meat is known to give guys a lot of trouble with their hearts and arteries. This predisposes a man to a heart attack. Because some men eat a lot of food in general, even for their body size, obesity is a real risk, and this can lead to arthritis, diabetes, and of course, heart disease. Thus, just like women, men need to focus on eating the right kinds of calories made up of fruit, vegetables, and whole grains, while holding back on grilling every type of meat known to man. But dietary influences go beyond the battle of the sexes. Cultural differences are important to note. Some cultures and even religions emphasize a vegetarian or even vegan diet. A vegan diet refers to a diet that excludes meat and animal products, such as milk and eggs. Such cultural, religious, or purely personal dietary choices are fine so long as they are made with care and consideration. For instance, vegetarians need to seek out protein sources other than meat in order to stay healthy. This can include eggs, milk, tofu, beans, and so forth. In addition to culture and gender, age plays an important role in influencing dietary choices. As a person ages, certain dietary modifications may need to be taken. Since the elderly tend to move around less, they need to consume fewer calories to maintain a healthy weight. Because their digestive system doesn't work as well as before, elderly people may need to supplement their diets with vitamin B12 and fiber. Vitamin B12 is given because it's normally absorbed in the intestines, but this function may decline with age or disease. Fiber is given because elderly people are more likely to develop constipation, and fiber helps to move the digestive content along the intestinal tract a bit better. Finally, other select groups of people must keep in mind that they may need less or more of something than the general population. Let's take a look at 3 examples. Athletes may need to consume more nutrients and calories in order to maintain a healthy weight in the face of burning off a lot of the food they eat through their exercise. Even more importantly, athletes need to make sure they are properly hydrated during practice or a game. This helps to regulate the body better and ensure proper function and the highest performance possible. Some athletes are college students, but not all college students are athletes. What I'm trying to get at here is that many college students, either due to time constraints, stress, or just the culture of it all, do not have very healthy diets. Students tend to overeat, especially if served buffet-style food. That's why paying attention to portion sizes is so important. Lastly, for this lesson are individuals with special dietary concerns. People with medical conditions, such as hypertension or high blood pressure, need to limit the amount of salt they eat. Pregnant women, because they're eating for 2, need more calories, vitamins, and minerals than a woman who isn't pregnant. Overall, I think you get the picture. You are unique and have special dietary needs. As life changes, those dietary needs and choices may change as well. For example, gender differences are important to note. Two nutrients known as calcium and iron are of special concern for women. Calcium is a mineral that helps to build strong bones, and iron is a mineral that helps to form red blood cells. Calcium is necessary because women are more likely to develop osteoporosis, a condition that leads to fragile bones. Iron is important for menstruating women because it helps to avoid iron deficiency anemia. Anemia is a low red blood cell count. Furthermore, cultural or personal beliefs that lead one to have a vegan diet, a diet that excludes meat and animal products, necessitates the person on such a diet to seek out vegetable-based sources of protein. As people age, vitamin and fiber supplementation is important. Athletes need to drink more than those with a sedentary lifestyle. Pregnant women need more nutrients, and people with medical conditions need to alter their dietary choices as well.
A diet adaptation is when a person changes their diet. This includes modifying the diet because of a medical condition or in preparation for a procedure or surgery. This is most often necessary for certain medical procedures. For example, a doctor may have a patient start a clear liquid diet before a colonoscopy, which is a procedure that looks inside the colon using a camera called a colonoscope. A clear liquid diet is a diet that consists only of clear liquids and leaves no undigested residue in the intestinal tract. Doctors may also start patients on this diet after surgeries or if a patient has digestive issues like nausea or diarrhea. Patients cannot stay on this diet for more than a few days because it does not meet caloric or nutritional needs. On a clear liquid diet, a patient is allowed to consume the following: water, fruit juice without pulp, fruit-flavored drinks such as punch or lemonade, sodas including dark-colored soda, plain tea or coffee, vegetable juices, broths, sports drinks, gelatin, honey or sugar, hard candies, ice pops without dairy or pieces of fruit. A full liquid diet is similar to a clear liquid diet but less restrictive. On a full liquid diet, a patient can have any food or drink that is a liquid at room temperature. This means that, in addition to everything on the clear liquid diet, a person can also eat milks, including cows and alternative milk options such as almond or soy, pureed soups, ice cream, yogurt without fruit, cooked cereals thinned with milk or water, eggs as a soft custard, pudding, syrup, and melted cheese. This diet is used as a middle step between a clear liquid diet and a soft diet. After certain surgeries or procedures, some patients will need to slowly add foods back into their diet. A full liquid diet is useful in this situation because it allows the patient more options, calories, and protein without overworking the patient's digestive system. A soft diet is a low residue and low fiber diet consisting of only soft, easily digestible foods. Patients on this diet have many more food options than on liquid diets. In addition to foods allowed on the liquid diets, patients are also able to eat soft-cooked or creamed vegetables, such as mashed potatoes or creamed corn, peeled soft fruits, such as pears or peaches, melons, pastas, rice with sauces or gravy, breads, beans, eggs, soft meats, such as meatloaf or fish, cakes, cream pies, custards, and smoothies. There are two types of soft diets. A mechanical soft diet is designed for people who have difficulty ingesting food, such as elderly people with dysphagia or difficulty swallowing. Cancer patients who have mouth tenderness can benefit from a mechanical soft diet. A gastrointestinal GI soft diet is for people who are transitioning from a liquid diet to a regular diet. This may be necessary for patients recovering from major surgeries or who suffer GI conditions such as diverticulitis, ulcerative colitis, or irritable bowel syndrome. A GI soft diet focuses more on ways to reduce irritation and inflammation to allow the GI tract to heal. Because of this, some foods that are known to cause irritation may not be allowed, such as tomato products, spicy foods, or foods high in fat. The soft diet provides enough calories, protein, and nutritional needs so patients can remain on this diet long term if needed. Some patients who are unable to meet nutritional needs orally will need alternative feeding methods. This means they will need to receive feedings from a tube. There are two different methods to receive tube feedings. The first is called a gavage, which is a tube that is inserted through the nose or mouth and extends into the stomach. The second is a gastrostomy, a tube that is surgically placed through the abdomen directly into their GI tract. Since a gastrostomy is surgically placed, it is intended for patients who will need tube feedings for a longer period of time. Patients receiving tube feedings are given enteral feedings, a liquid nutritionally complete food containing protein, carbohydrate, fat, water, minerals, and vitamins. There are many reasons that patients require tube feedings. Premature or failure to thrive infants may require tube feedings, while other conditions are being cared for during a neonatal intensive care unit (NICU) stay. Patients with severe dementia or dysphagia may require tube feedings. Other patients that may benefit from tube feedings include those with the following conditions: neurological or neuromuscular disorders such as stroke or amyotrophic lateral sclerosis (ALS), cancers, especially of the head and neck, which can cause an obstruction near the esophagus, making swallowing food very difficult, malformations of the mouth or esophagus, post-surgical and digestive disorders. A diet adaptation is when a person changes their diet. This includes modifying the diet because of a medical condition or in preparation for a procedure or surgery. This is most often necessary for certain medical procedures. A clear liquid diet is a diet that consists only of clear liquids and leaves no undigested residue in the intestinal tract. Doctors may start patients on this diet after surgeries, or if a patient has digestive issues, such as nausea or diarrhea. A full liquid diet is similar to a clear liquid diet, but less restrictive. On a full liquid diet, a patient can have any food or drink that is a liquid at room temperature. This diet is used as a middle step between a clear liquid diet and a soft diet. A soft diet is a low residue and low fiber diet consisting of only soft, easily digestible foods. There are two types of soft diets. A mechanical soft diet is designed for people who have difficulty ingesting food, such as elderly people with dysphagia or difficulty swallowing. Cancer patients who have mouth tenderness can benefit from a mechanical soft diet. A gastrointestinal, GI soft diet is for people who are transitioning from a liquid diet to a regular diet. This may be necessary for patients recovering from major surgeries or who suffer GI conditions such as diverticulitis, ulcerative colitis, or irritable bowel syndrome. Some patients who are unable to meet nutritional needs orally will need alternative feeding methods. This means they will need to receive feedings from a tube. There are two different methods to receive tube feedings. The first is called a gavage, which is a tube that is inserted through the nose or mouth and extends into the stomach. The second is a gastrostomy, a tube that is surgically placed through the abdomen directly into their GI tract. Some reasons for requiring tube feedings include prematurity, infants, severe dementia or dysphagia, and neurological or neuromuscular conditions such as stroke or ALS.
Nursing is a very diverse field of work. Nurses are able to work in many different settings, including hospitals, doctors' offices, schools, clinics, and in the community. No matter in what setting a nurse chooses to work, they need to be knowledgeable in assessment skills. In this lesson, you will learn about obtaining health information from patients through health history and nutritional and gastrointestinal assessments. A health history assessment is an interview with the patient about their past and current lifestyle and is used to determine their health status. It is important to assess the psychosocial, ethnic, and cultural background of the patient while obtaining a health history. The physical environment and activities of daily living, including details about lifestyle, are discussed. The nurse also assesses current health problems, medical history, and family history. This is a great time to get to know a patient. Patients that trust their healthcare providers and know they truly care about them are much more likely to give thorough and truthful information. Good nutrition is important to everyone's health, and nutrition is thus an important part of the health history assessment. Many disorders can be caused by nutritional deficiency, overeating, or eating unhealthy meals. These behaviors can lead to major illnesses such as heart disease, cancer, and stroke. The nutritional assessment focuses on examining a patient's nutritional status and providing information about obesity, weight loss, malnutrition, deficiencies in specific nutrients, metabolic abnormalities, effects of medications on nutrition, and other specific problems affecting the patient. During the nutritional assessment, it is important to visually assess the appearance of the patient. Certain signs and symptoms are suggestive of nutritional deficiency, such as muscle wasting and poor skin integrity. Other signs may indicate other conditions. For example, truncal obesity may be a sign of endocrine disorder called Cushing's disease. Information that is necessary to obtain during the nutritional assessment includes body mass index (BMI), waist circumference, biochemical measurements, clinical examination findings, and dietary data. The body mass index (BMI) is a ratio based on the patient's body weight and height. A patient's BMI can be calculated using the following formula. BMI equals 703 times weight in pounds divided by height in inches squared. Typically, a BMI of 18 to 24 is considered normal. 25 to 29 is overweight. 30 to 39 is obese, and 40 and above is extremely obese. Biochemical assessment is the study of a patient's nutritional status by examining their blood and urine. Specific studies include the serum, albumin, transferrin, retinol-binding protein, electrolytes, hemoglobin, vitamin A, carotene, vitamin C, and total lymphocyte count. The urine study includes creatinine, thiamine, riboflavin, niacin, and iodine. Abnormalities in these values can reflect protein deficiency, inadequate liver or kidney function, or other diseases or infections. Clinical examination findings are the patient's general appearance during a health history or examination. Signs of good nutrition include a normal body weight with respect to height and the appearance of health in the person's body tissues. This includes their hair, skin, teeth, gums, mucous membranes, abdomen, extremities, and thyroid gland. Examples of findings from poor nutrition include poor skin turgor. This could indicate dehydration. Edema or swelling, dryness of skin and hair, poorly healing wounds, under or overweight, bruises, and lack of muscle tone. Dietary data is used to determine if the patient's dietary intake is adequate and appropriate. This data is obtained through the dietary history. For some patients, a 24-hour recall of their diet is all the information that is needed. For patients who are having more severe problems or symptoms, a more detailed history may be needed. Some are instructed to record everything they consume for several days before their appointment or hospitalization. This information is necessary to determine if a certain food is causing problems, such as an allergy or intolerance, or to determine if a deficiency is present. The gastrointestinal GI assessment is a complete examination of current and past gastrointestinal information obtained by a physical assessment and health history. Questions should be asked about symptoms such as pain, gas, indigestion, nausea and vomiting, diarrhea, constipation, fecal incontinence or leaking, jaundice or yellowing of the skin, changes in bowel habits or characteristics, or previous GI diseases, whether affecting the patient or the family. The physical assessment includes techniques of inspection, auscultation, percussion, and palpation. Inspection is a visual examination of body parts. The mouth, gums, and tongue are inspected for intactness and appropriate hydration. The abdomen can be divided into 4 quadrants: right upper, right lower, left upper, and left lower. The abdomen is inspected for wounds, bruises, nodules, lesions, scarring, discolorations, or inflammation. Any bulging or distension should also be noted. Auscultation is listening to body sounds with a stethoscope. It is always completed before percussion and palpation because these can change the bowel sounds. Auscultate each quadrant. Clicks and gurgles are normally heard from 5 to 35 sounds per minute. Bowel sounds can be described as normal, every 5 to 20 seconds. Hypoactive, 1 or 2 sounds in 2 minutes. Hyperactive, 5 to 6 sounds in 30 seconds, or absent, 0 sounds in 3 to 5 minutes. Percussion is a method of tapping used to assess the size and density of underlying organs. It is also used to detect air-filled, fluid-filled, or solid masses. It is generally used concurrently with palpation. Palpation is the examination of using hands with either light or deep pressure to find abnormalities. It is particularly useful for identifying areas of tenderness or muscle resistance. It also can help the examiner to identify any masses. A health history assessment is an interview with the patient about their past and current lifestyle that is used to determine their health status. The nutritional assessment focuses on examining a patient's nutritional status and provides information about obesity, weight loss, malnutrition, deficiencies in specific nutrients, metabolic abnormalities, effects of medications on nutrition, and other specific problems affecting the patient. Poor nutritional status can eventually lead to diseases such as cancer, heart disease, and stroke. Information that is necessary to obtain during the nutritional assessment includes body mass index, BMI, waist circumference, biochemical measurements, clinical examination findings, and dietary data. The gastrointestinal GI assessment is a complete examination of current and past gastrointestinal information obtained by a physical assessment and health history. Questions should be asked about symptoms such as pain, gas, indigestion, nausea and vomiting, diarrhea, constipation, fecal incontinence or leaking, jaundice or yellowing of the skin, changes in bowel habits or characteristics, or previous GI diseases, whether affecting the patient or their family. The physical assessment includes techniques of inspection, auscultation, percussion, and palpation of the GI tract.
A vitamin is an organic compound that is essential for normal growth and nutrition. Vitamins are required in small amounts in the daily diet because they cannot be synthesized or made by the body. Vitamins are found naturally in plants such as fruits and vegetables, and also in animal sources. Vitamins have a wide variety of importance and function in our bodies. Some examples of vitamin functions include helping to promote growth and repair of tissues and cells, acting as antioxidants, and improving metabolism. An antioxidant is a molecule that stops the action of free radicals. Free radicals occur naturally in the body and can cause damage to cells, which could lead to cancer. There are 13 vitamins presently that are universally recognized. Vitamins are either water-soluble or fat-soluble. Water-soluble vitamins, B vitamins and vitamin C, dissolve in water and are excreted through the kidneys if excess amounts are taken. Fat-soluble vitamins, vitamins A, D, E, and K, dissolve in fat and are stored in the fat of the body. It is more difficult for the body to excrete excess fat-soluble vitamins, which makes it possible for toxic levels to accumulate if too many are taken. Water-soluble vitamins dissolve in water and cannot be stored for later use by the body. There are a total of 9 water-soluble vitamins. They are the B vitamins, folate, thiamine, riboflavin, niacin, pantothenic acid, biotin, vitamin B6, vitamin B12, and vitamin C. Folate is very important in the synthesis of DNA. For this reason, folate is vitally important during pregnancy and the prevention of birth defects. Folate is available in leafy green vegetables and legumes, seeds, orange juice, liver, and many enriched refined grains. Thiamine plays a role in the transmission of nerve impulses by promoting nerve health. Thiamine is also needed for the metabolism of carbohydrates and amino acids. Thiamine is found in pork, whole grain breads and cereals, and nuts and seeds. Riboflavin helps with the metabolism of carbohydrates, proteins, and fats. It also helps to enhance the function of niacin and vitamin B12. Riboflavin is found in leafy greens, milk products, and enriched breads and cereals. Niacin is necessary for skin tissue health and proper functioning of the digestive system. Niacin can also help lower triglycerides and LDL cholesterol, bad cholesterol, while raising HDL cholesterol, good cholesterol. Meat, poultry, fish, whole grain and enriched breads and cereals, vegetables, and peanut butter are all sources of niacin. Pantothenic acid and biotin help the body obtain energy from food ingested and are necessary for metabolism. Pantothenic acid also assists in the production of hormones and cholesterol. Biotin is produced in the gut by bacteria. Both pantothenic acid and biotin are available in a wide variety of foods. Vitamin B6 plays a very important role in the production of non-essential amino acids and helps the body break down glycogen. Glycogen is the storage form of glucose. The body will break down glycogen when energy is needed. Vitamin B6 assists in the metabolism of nutrients and helps keep the immune and nervous systems healthy. Vitamin B6 is available in meat, poultry, fish, vegetables, and fruits. Vitamin B12 is needed for metabolism of fatty acids and amino acids and is also necessary for DNA synthesis. It helps to keep the nervous system functioning appropriately and red blood cells healthy. Vitamin B12 is found in meat, poultry, fish, seafood, eggs, and milk products. Vitamin C is needed to make collagen. Collagen is a structural protein. It is in the bones, skin, teeth, blood vessels, and other connective tissues throughout the body. Vitamin C is an antioxidant and helps to reduce the risk of developing some chronic diseases such as heart disease and cancer. It also helps to support our immune system. Vitamin C is found only in fruits and vegetables. It is found in citrus fruits, vegetables in the cabbage family, cantaloupe, strawberries, peppers, tomatoes, potatoes, lettuce, papayas, mangoes, and kiwi. Vitamins A, D, E, and K are the fat-soluble vitamins. They are called this because they are soluble in lipids, which are fat. After ingestion, they are absorbed into the blood circulation, where they will then be stored into the body tissues. Once they are in the tissues, they tend to stay there. For this reason, if a person takes in too much of a fat-soluble vitamin, over time that vitamin can accumulate in their body. This is a potentially dangerous situation called hypervitaminosis and means that too much of a vitamin is present in the body. People can also have a deficiency of fat-soluble vitamins if their fat intake is low or fat absorption in their diet is compromised. Some medications or disease processes can interfere with the absorption of fat in the intestine. This compromise can result in a deficiency of fat-soluble vitamins. Vitamin A, also known as retinol, has many key roles in the body. It helps eyes adjust to changing light. It also is involved in bone growth, tooth development, reproduction, cell division, gene expression, and the immune system. Vitamin A helps the mucous membranes, or lining, of the mouth, nose, throat, and lungs to stay moist. Vitamin A is also an antioxidant and helps in the prevention of some cancers and diseases. It can be found in animal and fish livers, milks and cheeses, leafy greens, carrots, cantaloupe, papaya, and mangoes. Vitamin D plays a very important role in the body's ability to use calcium and phosphorus. It allows calcium to be absorbed during digestion. This helps in the formation and maintenance of bones. Vitamin D also supports the immune system and assists in controlling cell growth. It is especially important that growing children have proper amounts of vitamin D to help in the development of their bones and teeth. Cod liver fish oils, herring, and salmon are rich in vitamin D. Milks and cheeses are also good sources. Vitamin E is an antioxidant. It acts to protect vitamins A and C, the red blood cells, and essential fatty acids from damage. Vitamin E and other antioxidants is known to lower the risk of heart disease and cancer. Research shows to receive the full benefits from antioxidants, it is best to eat a diet full of fruits and vegetables rather than taking them as a supplement. It can be found in nuts, grains, and leafy greens. Wheat germ is also a good source of vitamin E. Vitamin K is vital to the body's normal blood clotting ability. It helps in the production of proteins for blood, bones, and kidneys. It is naturally produced in the intestines by bacteria. The best source of vitamin K is in leafy greens such as spinach, kale, turnip greens, and collards. A vitamin is an organic compound that is essential for normal growth and nutrition. Vitamins are required in small amounts in the daily diet because they cannot be synthesized or made by the body. There are a total of 13 universally recognized vitamins. Vitamins are found naturally in plants, such as fruits and vegetables, and also in animal sources. An antioxidant is a molecule that stops the action of free radicals. Free radicals occur naturally in the body and can cause damage to cells, which could lead to cancer. Water-soluble vitamins, B vitamins and vitamin C, dissolve in water and are excreted through the kidneys if excess amounts are taken. There are a total of 9 water-soluble vitamins. They are the B vitamins, folate, thiamine, riboflavin, niacin, pantothenic acid, biotin, vitamin B6, vitamin B12, and vitamin C. Fat-soluble vitamins, vitamins A, D, E, and K, dissolve in fat and are stored in the fat of the body. If a person takes in too much of a fat-soluble vitamin, over time that vitamin can accumulate in their body. This is a potentially dangerous situation called hypervitaminosis and means that too much of a vitamin is present in the body.
Minerals are chemical elements required by the body for normal function. The body uses minerals for many different jobs, including building bones, making hormones, and regulating the heartbeat. They are divided into 2 groups, macrominerals and trace minerals or microminerals. Both groups are important, but macrominerals are needed in larger amounts than trace minerals. Eating a balanced diet will usually provide all of the needed minerals. Macrominerals are required in larger levels in our bodies for proper functioning. The following minerals make up the group macrominerals: sodium, chloride, potassium, calcium, phosphorus, magnesium, and sulfur. Sodium functions to maintain proper fluid balance in the body. It is also necessary for muscle contraction and nerve impulse transmission. It is found in table salt, soy sauce, and in processed foods. It is also found in small amounts in milk, bread, vegetables, and some meats. Chloride needed for proper function of stomach acid and also for fluid balance maintenance. It is found in table salt, soy sauce, and in processed foods. It is also found in small amounts of milk, meats, bread, and some vegetables. Potassium is required for normal fluid balance, muscle contraction, and for nerve impulse transmission. Meats, milk, fresh fruits and vegetables, whole grains, and legumes are good sources of potassium. Calcium is needed for healthy bones and teeth. It is also needed to help muscles relax and contract, nerve functioning, blood clotting, regulating blood pressure, and supports the immune system. It is found in milk and milk products, fortified tofu and soy milk, vegetables such as broccoli and mustard greens, and legumes. Phosphorus is found in every cell. It is necessary for healthy bones and teeth. It plays a role in normal acid-base balance. It is found in meat, fish, poultry, eggs, and milk. Magnesium is found in the bones. It is necessary for protein production, muscle contraction, nerve impulse transmission, and supporting the immune system. Nuts and seeds, legumes, leafy greens, seafood, artichokes, chocolate, and hard drinking water are good sources of magnesium. Sulfur is found in protein molecules. It is found in foods high in protein such as meats, poultry, fish, eggs, milk, legumes, and nuts. Trace minerals, also referred to as microminerals, are required in smaller amounts in our diet. The following minerals make up the group trace minerals: iron, zinc, iodine, selenium, copper, manganese, fluoride, chromium, and molybdenum. Other trace minerals known to be essential in small amounts include nickel, silicon, vanadium, and cobalt. Iron is an essential part of a molecule that is found in red blood cells. It is necessary to carry oxygen throughout the body and needed for energy metabolism. It is found in organ meats, red meats, fish, poultry, shellfish, egg yolks, and legumes. It is also found in dried fruits, leafy greens, and fortified cereals and breads. Zinc is needed for the production of protein and genetic material. It is necessary in wound healing, reproductive maturity, normal fetal development, immune health, and even has a function in perception of taste. It can be found in meats, fish, poultry, leavened whole grains, and vegetables. Iodine is necessary for the production of thyroid hormone, which regulates growth, development, and metabolism. Sources of iodine include seafood, foods grown in iodine-rich soil, iodized salt, bread, and dairy products. Selenium is an antioxidant. It is found in meats, seafoods, and grains. Copper is a necessary part of many enzymes in the body. It is needed for metabolism of iron. It can be found in legumes, nuts and seeds, whole grains, organ meats, and drinking water. Fluoride assists in the formation of bones and teeth and also protects teeth from decay. Drinking water, fish, and most teas are sources of fluoride. Chromium helps insulin to regulate blood glucose sugar levels. Chromium is found in unrefined foods, brewer's yeast, liver, whole grains, nuts, and cheeses. Molybdenum is part of some enzymes in the body. It is found in legumes, bread, grains, leafy greens, milk, and liver. Minerals are chemical elements required by the body for normal function. The body uses minerals for many different jobs, including building bones, making hormones, and regulating the heartbeat. They are divided into two groups, macrominerals and trace minerals or microminerals. The following minerals make up the group of macrominerals: sodium, chloride, potassium, calcium, phosphorus, magnesium, and sulfur. The following minerals make up the group trace minerals: iron, zinc, iodine, selenium, copper, manganese, fluoride, chromium, and molybdenum. Other trace minerals known to be essential in small amounts include nickel, silicon, vanadium, and cobalt.